Before we start, just wanted to point out two important points. Whenever we talk about any science in the world, it ends in the suffix logy, geology, psychology, biology, and we Christians understand that the wisdom of God, the mind of God, is creating and coordinating all the universe, the logos. So whenever we talk about any branch of science, the logi, we're actually studying the work of the logos. So there is no contradiction between this and this. So the logos is in the universe, the logos is in every branch of science, and the logos is beyond science. So we'll first start with science, and then we'll look from the perspective of the other world, with which we're connected, and how do they perceive the science, or how does God look at it? And second point, whenever we talk about any psychology, please don't diagnose yourself and don't diagnose anyone else. Don't label yourself, don't label anyone else. What we're saying here is just general terms. If there is any specific, if you have any doubts about anything, you can go to a specialist. But with us sitting here, thinking, oh, that's me, no. We may talk about extremes, but of course, there is no black and white in life. So don't diagnose yourself, don't label yourself, don't label anyone else, because we're just saying some broad general terms. Now, talking about psychological development, there are many theories about the psychological development. We just picked up two most well-known. This is Freud, Shafi'a Faslina, Freud. And this is Erickson. Freud is the founder of psychology and psychiatry. He was a neurologist. And then he started to think that there are other symptoms that may not simply are bodily symptoms. There are more into that. And of course, he wrote his first epic book, The Interpretation of Dreams. Erick Erickson was another psychologist, and he has his own perspective in development. We'll just talk about how do they define us. Freud said that our mind, this is a representation of the mind. I'm not talking about the brain, the mind. The mind is part of your brain. Your personality is mainly your frontal lobe here. This is your personality. If you have a stroke here, you may be lost. I mean, your memory is lost. Your all whatever gigabytes are here, they're lost. So, the mind, it is unconscious, preconscious, and conscious. Unconscious is just something that you're not aware of. And then the conscious, which is you. And then he further divided us into three persons, or we can say three levels. Id, or it, that's the infantile, erotic, very simple, primitive way, or primitive personality that we have. A baby, the erotic, the aggressive, the infantile. Ego, the realistic, and the ego and id, they both have the same aim. But the ego has a rational way of reaching the goal. Not just, I want this and I have to get it now. We'll tell you examples. And of course, the ego reduces anxiety and avoids pain. So your ego wants you to be happy. You want yourself to be happy and to avoid pain and reduce anxiety. And then we had the superego, the moral, the perfection, religion, sublimation, every beautiful moral code in the world. So we have the id, ego, and superego. Let's get an example. So it's Sunday after church. Every one of us is in the basement. I'll talk about myself. My id, I want to eat this cake right now. What I should do, just punch everyone in the basement and go and eat the cake. There is a cake on the table. I want to eat the cake. And Abuna didn't pray yet. Abuna should start praying. Okay, I'm hungry. I have to eat this now. I want this right now. Ego will tell me, let's wait till they allow us to eat. Or you can go and ask someone to give you this cake. There are rational and there are ways that make sense that you can use so that you can reach your goal and eat the cake. Superego, you should give it to someone who's more hungry than you. You should sacrifice your hunger and give it to someone else. So these are the three levels. So the id is usually in the subconscious. You would never show this. If you show it, maybe you're drunk, or maybe there is some kind of a problem in personality or mental illness. So this is our primitive, if we may call it another name, And we'll talk about that in the next slide. This is our very primitive thinking, or the primitive personality, the baby inside us. And then the ego, this is developed by society, by what our parents raised up to be, and what is the social norms around you. For example, if you live in Africa in a tribe, the ego would tell you that you can go around without any clothes. And there's no problem. This is the social norm. In another tribe in Africa, this is the social norm. So ego is responsive to society. And then the superego, the morals, beyond the normal, beyond the usual, which is the very high ethics and morals and spirituality. Another example, he made me mad, I want to punch him. This is the id. The ego would tell you, well, let's do it when no one is around. So the ego is not always innocent. The ego is just giving you a way out. Let's do it when no one is around. Superego, forgive him. Don't punch him. Forgive him from your heart. So what happens in the mechanisms here? If the ego goes towards the... Yes?
Sorry. The superego, isn't it affected by the culture as well?
Yes. It is affected by the culture, but the ethics and morals of the culture, not just the norms. The ethics and morals, including religion, including philosophy, including if I learned from a suffering experience. So it's affected by the cultures, but the ethics and morals, not just the norms. Because every culture has its own ethics, its own morals, its own religious morals, spirituality. So the superego is also affected. It's not separate. What happens here is that if the ego goes towards the id, towards the primitive you, towards the desire, erotic, angry, right here, right now personality, what happens? Superego here punishes the ego with guilt. You feel guilty. So if I followed my desire and punched everyone in the basement and ate the cake, I would feel guilty. Of course, it depends. Sometimes some people, they don't have this superego. They were not brought up to respect the morals. And we call them the antisocial or the psychopath. Otherwise, I would feel guilty. And then, if I go towards the ego and do the good things, then go with the morals, it makes you feel good or even proud. So again, the superego is not really 100% innocent. It can give you pride, self-righteousness. So the conflict between the id and ego and superego looks familiar. Have you heard this before? Did someone say something about that in the Bible? A conflict between a new and old, or between the spirit and the body. Exactly. The spirit and the body. So there is a conflict, and Freud recognized it, and even St. Paul, by the Holy Spirit, recognized it. Just the names are different. Ego, superego, and id. So the ego also, we use the ego a lot in our terms when we talk about spiritual life. The ego is responsible for your defense mechanisms. It protects you. Some defense mechanisms, for example, like denial. Someone told me that I have cancer and I'm going to die in a week. I'll just act like nothing happened. I know that I have cancer, but I'm acting in a way that as if I don't have cancer. Denial. And there are many other defense mechanisms. Even mental illness is explained, in the psychological pathway, not the chemical, that the ego is trying to protect your mind. For example, if a very old lady, like 66 years old grandma who's deserted and neglected by her children and grandchildren, and starts to think that the CIA is following her, in a way the ego is protecting her and giving her some kind of importance. She's scared because the CIA is following her and monitoring her by cameras and sending her messages by airplanes. But again, when you listen to her in a clinic, who are you? So the ego is protecting her. The ego is trying to shield her from destruction, from death. We'll talk about that. So Freud said that the ego is that part of the id, which has been modified, as we said, by the direct influence of the external world. And he proposed that the development is mainly psychosexual. He said that all our desires are mainly sexual. The baby is fed on, breastfed. This is the first stage of the sexual development, the oral stage. And then, as the baby grows older, there is the anal stage, the toilet training, and then the phallic stage. That's the sexual desire is mainly maintained by the sexual organs. So he said this is a psychosexual development, and this is a conflict between the id, the desire, and the superego, the morals. This conflict gives you anxiety, and you try to resolve this anxiety. This is what Freud thinks. In a way, he's not 100% wrong, but this theory lacks a lot. So Erick Erickson said, well, actually, I want to focus more on the ego. The ego here is responding to the social influence, which is mainly given to you, first of all, by your primary caregivers, your parents, or whoever is your primary caregiver. So psychosocial development here, it's not psychosexual, it's psychosocial. This is how the ego adapts in response to the external factors. This is the adaptation of the ego. You have to resolve the conflict of each stage. Otherwise, if the ego did not resolve or cannot resolve this conflict, then we get into trouble. Incomplete personality, unhealthy sense of self. So you should complete successfully each stage of your life. But he gives you hope. He tells you that there is always room for growth and development. And even if these stages have not developed yet, even if you're 60 years old and you haven't resolved your primitive development, there is a way out. There is a solution. Once you recognize that there are stages that you should have gone through. We'll talk about that in detail. First phase, the baby. Trust versus mistrust. It's from 0, since the baby is born, then to 18 months old. Simply, the baby is uncertain towards the external world. He or she are not certain. What's this? What's that? Who are these people? Who are these faces? And then the baby starts to develop by the second month the social smile. The first interaction with you is when the baby smiles to you, the social smile. So, your role as a primary caregiver, actually servants have no role here, so we'll just go over this quickly, but as a parent, you give something really important, consistent and predictable care. I know that when I'm crying, when I'm hungry, my mom is going to feed me. Okay, this is predictable. I know that my mother would never slap me, would never hurt me. I know that this is predictable. If, on the other side, or on the other hand, the parent did give a harsh or inconsistent care. Sometimes my mom is tender, nice. Sometimes my mom hits me. Sometimes my mom is too cruel. This will lead to insecurity. So if I completed or resolve this stage successfully, it will make me a person who has hope in crisis, secure relationships, and also can influence others. Forget about this insecurity. This is just a typo. Sorry about that. So I'll be very effective influencing others, having secure relationships with others, and I feel safe, even if there is a crisis. Because I have enough love when I was a baby. Enough love. So this is not a time to teach morals, of course. What kind of morals? Nothing. Just love the baby, give them love, give them food, and that's it. Then on the other hand, if it's harsh, inconsistent care, then we get fear and insecurity. And of course, we always tell the parents, be in the middle, be in between. For example, the baby can actually provoke you by crying. They can develop that. So don't yell, don't show an angry face, but at least show a masked face and tell the baby, no, no. Then the baby knows at least that this is not desirable, but again, it's not harsh. So you can control the baby, keep the baby balanced between not too spoiled and don't be too harsh on the baby on the other side. Be in the middle. Starting from 18 months old to 3 years, autonomy, the baby start to be independent, versus shame and doubt. So the baby is independent, the baby can help himself or herself to put on clothes, potty training, of course, play with toys, everything. So the primary caregiver here is giving support and guidance, and be very patient. Of course, don't spoil. Like, don't do everything for the baby. I'm doing everything for the baby. No, give the baby some independence. Let the baby do the trial and error. Let the baby make a mess in the apartment. It's okay. When you do potty training, let the baby do his pee-pee in his pants. It's okay. So let them do the trial and errors, and then by time the baby or let's say here the infant will start to develop the sense of independence. That will give them will and confidence. I mean, you know that the potty training commercials everywhere. Oh, you're a good man, you did it, you're a good baby. All these rewards and the stars that you give the baby because they did sleep without wetting their bed, all that reward style will give them confidence and they develop will. On the other hand, over control, not just by being harsh, over control means that you're doing everything for the baby, spoiling the baby, continuous criticism, that will get you a dependent and doubtful. Dependent because you didn't even give the baby a chance or give the infant a chance to do something on his own or her own. Or criticizing all the time, yelling all the time. So that makes me doubtful. Every time I do something, mama yells. Every time I do this, baba yells at me. So I should avoid this. Then I'll grow as a person who is doubtful, dependent. Of course, don't take this as a fact. There's always a gray area. Don't take this extreme as a fact. I'm just giving you the broad, general concept. Moving to the next phase, 3 years to 5 years. Initiation, initiative versus guilt. This is the first time we see this, guilt. So here the kids, they play and they plan activities, initiate activities, they explore and they ask. They ask many questions about everything. Of course, the most common question is why. The well-known example when you tell a story. Once upon a time, there was a princess. Where was the princess? In a palace. And how big was the palace? Oh, yeah, come on, خلصنا يعني. عايزين نخلص the story. No, he's asking about every detail. And they feel that they're the best in everything. So when the kid tells you, I'm the best in soccer, don't contradict your son or your daughter. Yes, you are. You're not lying. When they grow older, they'll know that you're not the best. But for now, give them this sense. Okay, you're the best, you're doing great. And encourage everything, every activity. Of course, again, with some control. Here, you should allow some guilt. But the guilt that allows self-control, not the destructive guilt. How? For example, if the kid wets his bed, sorry, not the baby, the kid wets his bed, for example. Okay, well, you shouldn't do that. This is a bad thing, but you're a good boy. This is a bad thing, but you're a good boy, not you're a bad boy. So you are good. I love you, whatever you do. Keep repeating that. I love you, whatever you do. But this is not good for you. So in a way, they develop some kind of responsibility and the guilt that happened here that I shouldn't do that. Not I'm bad, that's different. Some questions, of course, as we said, and activities and noise, they may be nuisance. So in a way, even if you're annoyed, don't give them the impression that you're annoyed. Of course, we all lose control when they get on our nerves. You're just coming back from work and then they're running everywhere and then, stop, I have headache. Okay, at least when you do that, I'm sorry baby, I'm sorry habibi, we can sit and talk and play. In a way, don't give them continuous message that their questions or their activities are annoying. Otherwise, they'll grow up feeling that they are a burden on the world, on everyone around them. I'm a burden. I think no one will accept me here. I think no one will accept me in this group. I'll always feel guilty that I am a troublemaker everywhere, although I'm not a troublemaker at all. And even this guilt may result in something that by time I realize that I'm bad. Okay, I'm bad anyway. So let's do the bad stuff, because I'm bad. Whatever I do, I'm not pleasing my mom and dad. Whatever I do, they don't approve it. They don't like it. So, okay, I'll be a bad boy. So, guilt, initiation or initiative versus guilt. Growing older, now we're in school, you have teachers, you have peer groups, you have society outside your family. And they're encouraging you, giving you assignments, and then you accomplish your homework, you graduate from each grade, and big celebration, you made it through preschool, kindergarten, and then first grade till sixth grade. We're proud of you, so there is some kind of industry. I'm learning to do something. And competence. Now I'm capable of doing math, of reading, of understanding science. Amazing. Of course, if there is no encouragement or restriction, So in a way, allow some risk, but of course under control. But don't be too scared for the baby or overprotective, for your son or your daughter, not the baby. Otherwise, they'll be insecure or incompetent. I can't do anything. Baba says this is dangerous. Mama says this is too dangerous, although it's not that dangerous. So there are some very, very trivial stuff. Like you can go out and play. What if I fall? Okay, fall. It happens. We'll clean you up. What if I hurt my knee, scratch my knee? Okay, fine. We understand that this happens. But of course, don't allow things that are too dangerous. We are not saying that, but we're saying allow some kind of a controlled adventure, a supervised adventure, while you're with your child. In that case, they'll be competent and industrious. Of course, you have to encourage them, helping them in their homework and everything so that they can develop their sense of competence. Now, teenagers. This is our challenging phase. It says identity versus role confusion. What am I doing in life? What are the future plans? Relationships with families and friends, trying to fit in, belonging to a society. So even their belonging here in church to a group, it's part of their belonging to a bigger society. Of course, there are sexual body changes, hormones playing their roles, and occupational identity. What do I want to be in the future? I want to be a doctor, an engineer, whatever. So in a way, they have a sense of what they want to be. It's like integrated sense of self and role in society, and it gets you to fidelity and commitment. I'm committed to something. This is where we give them servants prep, right? Commitment. Not just that we're teaching them, we're preparing them to be servants in that phase. From 12 years to 18, especially near the end. Otherwise, failure to achieve that, I'll be rebellious, I'll have identity crisis, and of course, I'll try to experiment other lifestyles, whatever wrong or dangerous these lifestyles may be, could be. Like, I don't know what I'll be in the future. Do you want to be a doctor? Do you want to be a musician? I don't know. You can just get a passive-aggressive kid, not necessarily a violent or someone who hits everyone, passive-aggressive kid. You can get someone who's not really interested in anything. We can look into that. Why is he or she not interested? What's going on? Let them talk. What's going on? What do you want? Who are you? And this is where we ask questions in Sunday school lessons. Who am I? Why am I here? We'll talk about that, of course, next time. So this is the teenagers, 12 to 18, identity versus role confusion. Reaching to youth, for sharing and long-term commitment. So commitment in teenager doesn't have to be long-term. So they may get into relationships, but of course no long-term relationships. This time there is commitment. Friendship, marriage, service, everything. So they're affecting others. They are comfortable relationships, giving love, sharing, serving in society, getting married, and they engaged everything. So failure will give you isolation, loneliness, depression. So this is intimacy versus isolation. This is the part where people fall in love, get married, everything. From 18 to 40 years. Growing older, 40 to 65. This is being part of community. You have a role in big picture in the universe. You're productive. You have careers, you have parenting. Otherwise, you develop care and productivity. Otherwise, you feel that you're useless, unproductive. You can see these happy parents, and you can see this nice lady here working, happy with her job. She's too happy. So generativity versus stagnation. I'm generative versus I'm stagnant. I'm stuck. I'm not doing anything. I'm useless. Then 65 plus, this is the end, retirement, and contemplating our accomplishment. What have I done in life? I wasn't there. You can listen to your grandparents or your old father, your father and mother talking about their glories in their childhood when they were young. What have they done? And they can tell you the story repeatedly, which is okay. This is how they are remembering their accomplishment. I did this, I did this, I did this. Feeling that I led a successful life, and that gives them wisdom. And they're accepting death without fear, smiling, happy, everything. Otherwise, if they feel guilty about the past and they not necessarily show it, maybe they show you that they feel guilty about the past and being aggressive and over-aggressive. Or, I led an unproductive life, I'm dissatisfied, hopeless, depressed. In that case, I'm not accepting death. Actually, I'm afraid to die because I feel that something here is not completed. It's not done. So, this is another level of service, 65 and plus. This is science. This is psychology. Now, the other side, from the heavenly point of view, it gives you the full picture. So these are the stages again. Trust versus mistrust in infancy, and the basic virtues of hope. Autonomy versus shape in early childhood, basic virtues will. Initiative versus guilt in the play age, 3 to 5, basic virtues purpose. Industry versus inferiority, school age 5 to 12, and gives you competency. Ego identity versus role confusion. Adolescence fidelity. Intimacy versus isolation. Young adult love. Generativity versus stagnation. Adulthood gives you care. And then ego integrity versus despair and gives you wisdom. As we said, the ego is resolving crisis. Ego is protecting itself from destruction and death. Death doesn't mean that you die. Death means that you may feel that you're dead inside. In the depressed patients, listen to them. They tell you, I'm dead, and they mean it. No interest in anything. It's beyond sadness. It's called anhedonia. Whatever, melancholia. That's why we got melancholia. Not interested in anything. I'm too sad. I'm too sad to do anything. So ego is protecting yourself, protecting you. So maybe you need external help. Maybe humanity needed external help. Okay, here is the help. And the Word was made flesh and dwelt among us. For as much then as the children are partakers of flesh and blood, he himself likewise took part of the same. Thus, through death, he might destroy him that had the power of death. And it's not just your physical death or separation death in eternal life. No, it means also death that you feel inside. In Christ, divinity is united to humanity. We all believe that. Divinity never parted from humanity, not even a twinkle of an eye, including your conflict, your psyche, which is the id and ego and superego. Let's go to the temptation here on the mountain. Satan told him, if you're the Son of God, tell this stone or order this stone to be a piece of bread. Feed your hunger, feed your id. Or feed your ego. Just jump and angels will carry you and everyone is going to see it. It will be a nice show. Or feed your super ego. Let everyone gives you glory. Feel that you're self-righteous. Or feed your ego. You can have possession of everything, but you have one rational way. One way that makes sense. Just bow to me. So if you look at the three temptations, they're actually targeting your id and ego and superego. And God didn't just win that for himself. He did that for you, for us, on behalf of us. And we can have this victory through him, or in him. Psychological development, Jesus as human, not as divine, as human. And Jesus increased in wisdom and stature and in favor of God and man. That's in Luke 2:52. This was how baby Jesus was growing up. Let's get back to our stages and see what happened. Jesus gone through these conflicts that we had, but he did something amazing. He conquered these conflicts for us. These feelings, any negative feelings that you had in life, he passed through it and he conquered it for your sake. This is what Saint Cyril said. So, let's go. This is what we sing in Tasbihah. He took what is ours and gave us what is his. We praise and glorify him and exalt him. That's in Friday Theotokia. This is how we sing it. He took what is ours and gave us what is his. This is my favorite part of Tasbihah. What happened? Trust versus mistrust. He had good parenting with Joseph and Mary as a baby. So he passed this and he abolished the mistrust for us. Then, this is a nice icon, taking his first footsteps. Autonomy versus shame and doubt. And let's sing it again. He took what is ours and gave us what is his. Initiative versus guilt. This is him trying to play and helping Saint Joseph, and this is him taking his steps, and his mom is guiding him. Industry versus inferiority. He didn't go to school, but he was helpful to his parents. In that case, he was learning how to be a carpenter to help Joseph. He didn't go to school. Jesus didn't go to school, and he had his purpose for that, because he wanted to tell Jewish people that his teaching is directly from the Father. So that's why. But he's not against school, of course. That gets us to, this is an important phase. Identity versus role confusion. Remember what happened here. When he was 12 years old, he went to the temple, sitting with priests in the synagogue, asking them and answering them. And his parents started to think that he's still a baby. He's still ours. We're still taking care of him. So they went looking for him, and then they went to him asking him, why have you left us? And then he said this answer, how is it that you sought me? Did you not know that I must be about my Father's business? So in the book of the interpretation of Gospel of St. Luke by Abuna Tadrus Ya'ub, he said that Jesus in that case is telling us a message on behalf of our sons and daughters. We have a mission. And this mission is my Father's business. He's saying that on behalf of every adolescent. He reached that identity versus role confusion. He knew what he was. He knew the identity. I'm talking as a human. So he's giving you that. He's talking on behalf of adolescents, that I can help your teenagers to reach their role, to reach their identity in me. I must be about my Father's business. That's amazing. That's amazing development. Okay, that leads us to the next phase. Intimacy, of course, friends with everyone, intimate relationships, disciples, everyone. That leads us then, he didn't reach 40 years, but he did what needs to be done in these 40 years. Generativity, healing people, because this is what we should do. When we reach that phase where everything is dealt with in the correct way, I can be generative, I can heal. Christ can heal through me, can raise the dead through me. We don't just mean the physical death. Christ is giving his disciples the order, raise the dead. And this is an order given to us, Christians, raise the dead. Everyone who's dead or feeling death. Even 65 plus, he reached that. In the last prayer between him and the Father, he said, I have glorified thee on earth. I have finished the work which thou gavest me to do. Cross and resurrection. So even this acceptance of death, he reached that. Even this satisfaction, he reached that. And he said, I have finished. And he can give you that as well. That you say the same. I have finished the work thou hast givest me. So St. Cyril said this expression, the Word was made flesh, can mean nothing else but that he partook flesh and blood like us and make our body his own. So his development was for our sake. And he also said, because the Son of God, because the Son is God from God, in some mysterious way, he passes this honor to us. For thus the power of death was overcome, and the dominion of corruption in our mentality and our psyche was, which had gained away over us, was destroyed. I'm just picking from St. Cyril because he was the one who defended the unity between the divinity and humanity of Christ. That's why I'm picking quotes from St. Cyril. So we believe that he himself had suffering, being tempted. This is important. He's been tempted, just like us. He's able to succor them that are tempted. And this is what we actually sing. Emmanuel ben Noti, Emmanuel our God. This is a nice icon for Jesus in church among the children, which now in our midst. Emmanuel our God, now in our midst. I think you know how he's in our midst. We take him. With the glory of his Father and the Holy Spirit, may he bless us all and purify our hearts and heal the sickness of our souls and body. Souls are translated into ipsiki, psychology, ipsiki. He is healing your ipsiki. And it's even put before your soma, before your body. So ipsiki and soma, before your body. So how do we become aware and promote the awareness of these facts? To be continued, and stay tuned. Any questions? حقيقة؟ لا بجد؟ طب خلاص. لا ثواني عشان سمعت. Okay. Would you like us to repeat the stages again or do it later? Sure, yeah, sure. This is just a summary. This is not everything. This is just a theory passing through the stages, but this is not everything, of course.
How should we benefit from knowing the characteristics of each stage? How can we use it? I think it's an open topic, but I mean, how, from a psychological perspective, how can we use this knowledge or this piece of information to apply it in the ministry, in our ministry?
What happens is that we label people, we label kids. So this kid is a headache. This kid is sick. He needs a psychologist to see him. This kid is overactive. Like there is a study that says that there is overdiagnosis of ADHD, attention deficit hyperactivity syndrome, which is actually a simply overactive kid, which is his age or her age. So by understanding this, we understand that this is part of the normal process of development. And there may be the ego of that kid is passing through some way of a conflict. So going onto the inner side of the kid, sitting with the kid, listening, what's going on, what's happening. So the kid that I may yell at, well, actually I can become friends with the kid, understanding that this is not just an abnormal behavior, even if it seems very abnormal. This is part of whether a conflict or a phase in development. So this gives us an understanding of what's normal, and although it's normal, it's labeled as abnormal.
Do you have some special resources for more deep awareness for different stages? So I know that every stage, I'm going to say pretty extensive for the psychology part. I mean for babies, for teenagers, for whoever. Do you recommend special resources like Christian psychologists who went through practical parts, like different real situations, and what to deal with, how to deal with the kids in these situations?
What I recommend is Dr. James Dobson. He's a very good writer. And the website, if you want to know more stages and details of stages, of course, it will take us hours to talk about this. That will be the American Psychology Association, APA. If you go to that website, APA, just Google it. It will give you lots of information. Not the American Psychiatry Association. Psychiatry will get you into the chemistry of the brain, but we want to talk about psychology, so American Psychology Association, not psychiatry. That can give you more and more. Of course, I like the British school, so Oxford Handbook is really useful, but it's okay. See, it's not UK, so go with the American Psychiatry or Psychology Association.
Thank you, Amir. And maybe out of this